Good evening. We're going to call this meeting of the Health and Human Services Committee to order. Apologize that we're running a few minutes behind. We hopefully are going to have all join us this evening to make sure that we have a quorum and can vote on the items in front of us. I will start by reading the order. Board of Alder's New Haven notice. The Health and Human Services Committee will meet in person on Thursday, November 20th, 2025 at 6:30 p.m. in the Board of Alder's Chamber, 165 Church Street, second floor, New Haven, Connecticut, to act on the following items. LM-2025-0584, order of the Board of Alders of the City of New Haven authorizing the mayor to accept a grant from the Cities for Financial Empowerment Fund in the amount of $50,000 over a 2-year period to support the Financial Empowerment Center's legacy planning services. And LM-2025-0587, order of the New Haven Board of Alders authorizing the City of New Haven to enter into an agreement in the amount of $250,901.64 with Goodwill of Southern New Haven to coordinate and execute the opening and operation of the city's re-entry welcome center in an attempt to reduce recidivism, gun violence, violent crime, and other offenses through a criminal violence prevention, trauma-informed public health approach. These items are on file and available for public inspection in the Office of Legislative Services, 165 Church Street, New Haven. For order, Honorable Eli Saban, Chair. Test, Honorable Michael Smart, City Clerk. If you need an accessibility-related accommodation, please contact 203-946-7651 or 203-946-8582. According to the City of New Haven COVID-19 policies, masks are not optional. Public may send comments or public testimony at newhavenct.gov. All right. My name is Eli Saban. I'm the chair of the committee. I represent Ward 7 on the board, and then my colleagues.
Kiana Flores, Ward 1.
Camden Singh, Ward 5.
Thank you, colleagues. We will now invite our presenters up to the table to discuss item 1. Thank you. Thank you for being with us this evening. Let's start by just giving us your name and address for the record.
My name is Dorita Mitchell. I'm the local government manager for the New Haven Financial Empowerment Center, 165 Church Street in New Haven, Connecticut.
Thank you. Please proceed.
The New Haven Financial Empowerment Center, we have been doing a lot of different financial services for these local residents, and I can use a chart just to show you just a little bit of what we've been doing over the past 4.5 years. What we're going to do now is to add legal legacy planning to our services, which will allow residents to be able to protect their assets and plan for the future, and work to stabilize their future and their families. What we're asking is that you would $50,000 grant, which is over a 2-year period. $20,000 each year is for personnel costs, $5,000 is for administrative costs, and we just want to make sure that there's no gaps that remain when our residents do not have easy access to affordable licensed services.
Please, Alderman Moran, introduce yourself.
Teresa Maria Ward 12.
So as you know, the Financial Empowerment Center provides free one-on-one financial counseling to help residents reduce debt, increase savings, build credit, and stabilize their financial markets. Over the last several years, our residents navigate to achieve long-term sustainability. The one major benefit is that residents do not have access to affordable, legally sound legacy planning tools such as wills, trusts, guardianship designations, and asset transfer plans. For many families, especially lower income households, this is not only a financial concern, but a stability, safety, and wealth preservation. This grant will allow us to close that gap. With the support of this grant, the New Haven Financial Empowerment Center will offer residents free access to a secure, confidential trust and will platform for 2 years. This ensures legal protection of assets, clear guardianship plans for children and dependents, organized acceptable documentation for families and executors, a structured plan for the transfer of wealth and belongings, helping families avoid unnecessary court costs or disputes, stability and continuity for households after the loss of a loved one. After the 2-year free period, residents may maintain the account for just $19 annually, only if they choose to make changes after the 2 years. This keeps the service accessible, sustainable, and extremely cost effective. How the grants will be used. This grant is intentionally structured to support service expansion, not existing operations. Funds will be used for community outreach and engagement, residents who do not currently utilize the financial empowerment services, including seniors, caregivers, young parents, and homeowners. This includes outreach events, printed materials, digital communications, and targeted presentations, workshops and education, offering recurring legacy planning workshops to explain the importance of wills and trusts, how to legally protect your assets, how to complete their free online planning documents, what documents to store, and how to communicate their wishes with community members. Program management and administrative capacity. As we expand our scope, the workload increases. Case management and follow-up documentation and data tracking will rise. This grant offsets costs directly associated with study time, workshop completion, tracking outcomes and reporting requirements, managing new client inflows. And this ensures that we can implement this effectively without placing strain on the city budget. Why the board should approve this grant? It costs the city nothing. This grant covers a service extension for 2 years. It strengthens long-term spiritual sustainability for community families. Estate planning prevents financial crises, protects children, and preserves intergenerational wealth. It expands equity. Wealthier households routinely use attorneys for wills and trusts. Low-income residents rarely have that access. This grant levels the playing field. It supports proactive, not reactive solutions. Legacy planning is preventative, reducing court involvement and conflict in emergency situations. It enhances the impact of an already successful city program. The FEC has proven results in debt reduction, credit improvement, and household financial stability. Legacy planning is a natural, powerful extension of that work.
Thank you.
Thank you for the invitation, for joining us, for all the work. Do we have any questions? Alder Saint.
Thank you, Mr. Steer. Thank you for your presentation. How would residents seeking your service, the outreach, flyer?
Absolutely, outreach and flyers, we're doing workshops as well, and so if we're ever in like, we're doing job fair and we're doing, we already do workshops for our Florida residents. So we're just going to be doing more to be more another service. So even if the client doesn't necessarily want to do the other, parts of the model for the financial empowerment center, if they want to just do the portion, that's fine.
This will be starting next year, or the legacy plan is ongoing?
It's just starting.
Just started.
Yes.
Okay, thank you. This because I think this is a helpful service for them. Cannot afford these. I'm looking forward, when you get a flyer, you could share it with me, so I can give my constituent, like to invite you to one of my management team to the presentation.
Absolutely, thank you very much.
Thank you, Mr. Chair.
Other questions? I was just wondering, where exactly is this grant coming from? Who is from the city's financial empowerment fund?
Yes, so it's a national program and there are FECs all over the country. And so this particular program is out of New York City and they started the FECs. And so this is where the grants come from. They have different sponsors and stuff that we want.
Excellent. Thank you. And then, do we have any estimate of how many people we think we might serve with the $50,000 grant?
We're looking to, that's kind of a good question, only because the FBC is over 500 clients this year. And so whoever would like to be a part of that and have that service, they'll be welcome.
Great. Do you have any other questions? Anyone? Thank you for the presentation.
We're looking forward to it.
Yeah.
Yes, we're looking forward to helping with outreach however we can.
Thank you very much.
And now invite presenters for item 2. Good evening. For joining us on this late phone call. Please just give us your name and for the record.
McKenna Booker, 165 Church Street, Nevada. Here at the office of the Goodwill Southern New England, 61 Amity Road, New Haven.
Thank you. Please proceed.
Also, by the way, I'm the coordinator for the Office of Violence Prevention. So today we're here to discuss the growing need for a centralized community welcome center in the city to better support individuals returning home from incarceration. Many of those face significant barriers to housing and health services amongst the plethora of mandatory. Currently, fragmented supports make it extremely difficult for residents to access consistent coordinated health. The reentry welcome center that will be housed within Goodwill will strengthen public safety, workforce participation, and community reintegration while advancing goals to reduce recidivism and improve post. Each year, roughly 800 people return home to New England, and the reentry welcome center will be to serve at least 400 restaurants and address pathway for reintegration, engagement, strategy, and support. Core services will include referral, housing connections, and navigation of health and behavioral health resources. The model also includes robust data collection through Africa 360 and outcome tracking to measure impact and improve the program. Regarding our partnership, Goodwill brings a long-standing and successful partnership with the City of New Haven, including prior city funded reentry employment services that achieved outcomes beyond the deliverables that organization has a deep history of working with the local law enforcement and the broader community network. Goodwill also has proven capacity to serve justice-involved individuals through evidence-based employment-focused programming, making it a trusted partner for this mission specifically. As far as our funding goes, this aligns directly with the City of New Haven's existing BoA opportunity that was awarded from the Board of Alders in 2022, but executed in October 2023. And this opportunity was strengthened in local and state reentry efforts. But Goodwill will be able to tap into this organization with proven infrastructure and capacity to deliver the high quality services that those coming from incarceration need. The funding supports both direct client engagement as well as data and impact measurement, ensuring strong accountability as well as transparency. More importantly, this model also positions us to incorporate additional state philanthropic workforce resources over time, allowing the initiative to expand sustainably over years. Regarding the purpose and impact of the Reentry Welcome Center, it's designed basically to be a one-stop shop, a single coordinated point of support for individuals returning home, making sure that they can quickly access mentorship, housing, and health and behavioral health services. By reducing the fragmentation and strengthening collaboration across agencies, the Reentry Welcome Center will help returning citizens stabilize more quickly and reintegrate successfully back into New Haven. The approach not only improves individual outcomes, but also enhances public safety, strengthens and advances statewide efforts to reduce recidivism and promote long-term stability and better quality of We are looking for some questions.
Thank you for the presentation and for your work. We have questions, Alex. Alderson.
Thank you, Mr. Chair. Thank you for your presentation. In terms of serving our reentry client, will there a location set already, or will there be a location to be set? The southeast.
There will be, there is one already. Donate our application.
Right, in our offices at 61 Avenue Road. We have a store there, but to the left of the store, we have offices where we do our programs.
Along with this program, we will be a communication system. It's back to the program because that's a hindering problem, transportation, getting to, from the, to participate in the service.
No, absolutely. And a big part of the reason that why we would like to move forward with Goodwill is because their location is neutral. And that's important as far as like gang and groups are concerned in New Haven, as well as right off of a public transportation line. So that proves ease of access for our participants.
We also provide bus passes, if somebody is driving with a gas card so that they can get, things like that. We can support their needs, as well as their immediate basic needs. By doing this, though, we will have somewhat of an idea of what the needs are before they come home, at least to the best participants, because our plan is to meet with them on the side and develop a plan for them, so that when they come out, we've already been in place.
What did you say the location was?
It's 61 Avenue Road. We're right across the street from A1 Toyota,
Yeah.
that little shopping plaza there.
So before this, these clients or partners really
In the facility? Yes.
So they're from the facilities, they will have a route, a way to get connected, get started.
Correctly. We would be the drop-off point for DOC. So DOC currently provides the transportation back to New Haven. So we would be the drop-off point. So they would be dropped off, I believe it's like 7. So there'll be some people that won't need all the services because they have family supports. And with those folks, we'll assist them to get home or whatever they need. And then those that have more bigger needs, hopefully we'll have the chance to met with them before they get back home, so we'll know what their needs are. And the staff will be there to welcome them and have a plan in place for them.
Would you be working with the reentry?
I'm sorry, what's the question?
Would you be working with the early reentry or?
Clients, yes, but we'll be starting on the inside working with the reentry counselors at the facilities, at the prisons. So they'll give us an idea of who's going to home. And we'll make appointments to go and meet with them.
What I'm asking, someone that population to get left out and be able to use the service.
Exactly.
Thank you.
Our access to Merritt Parkway makes it convenient for the vans to come right off the parkway. And we have 2 entrances. We have it back and front because they can enter through Whaley Avenue or they can enter through Ramsey Road.
Thank you, Alderson, and thank you for the response. So it is folks will be brought from the
Whatever
institution
they're in, right?
to this location.
Right.
Okay.
And these are the folks really that don't have any other means to get home. I know some people that are coming home, their family, always that somebody gets dropped off, but there are a lot of people that don't have that support.
Right. I mean, we hear sometimes that folks currently are get brought back home green. So this is the intention is to try to replace
Exactly.
that.
Exactly. It was happening there. It was happening. We're getting dropped off at the station. We're trying to avoid that because we used to get females. Part of one of our last programs where if somebody was coming home and needed a ride, we would be there at 7 o'clock to meet the bus when they dropped them off. This will be a little bit different. We have to meet them better. So won't have to be on hold.
Got it. And so how much of these services that are covered by this grant is the city already providing in some areas? None of them.
Right now, we have a grant program that is employment focused at the current time. We provide a class once a month that teaches people how to do job interviews, resumes. We do a lot of job. We have speakers come in and talk about and all that. Once they complete the class, we work to help them find a job. So we have an existing program that's not funded, it's federally funded. This would be addition to that employment program, but these folks would obviously participate in those services.
And how long do you expect that somebody would be, I mean, like, first day they get dropped off, and
I think it depends on their needs. So you'll have some people that have more needs than others that will need to work with on a much more basis. They'll be tied into other programs like or something like that. And then they'll need that program, they just need some basics for like identifications or that they could be helping with.
And a big piece of that too is like depending on their risk, where we have developed a new risk needs assessment that we also talked about as program goes, but that would also be still as well as other risk assessments at the reentry level center. And that will help determine like they'll start at the reentry level center, but then depending on their risk, depending on their needs, will determine the referrals that they get moving forward with other respective organizations.
got it. But it's not just like the first day, I presume.
Oh, no, it's an ongoing thing for sure. Yeah.
And the three positions here for coordinator, employment specialist, press case management. Funded by this grant, or they are also like the press case manager funded by anything else?
So there's one position that I forgot to add on there, and that is the community advocate, but the city will be positioned to fund everything for the Reentry Wellness Center, about like 33 to 35%. Everything else will be more like sustainably funded through goodwill. Yeah. So it's not just city funded only.
But the $250,000 grant is covering that 33% of the city's contribution.
We'll be increasing by 2 staff members in this position, and then I'm the program coordinator, and we have a so we would be looking to increase by a case manager and a community advocate with something with experience. Change their lives in their own here, being successful in this.
What is the
Mostly peer mentorship and outreach. Making sure that people get to where they have to go, making sure that they have the supports that they need as far as their being able to talk to somebody who's been it and giving them that boost in their self-esteem. And also to just like if we track of somebody, for instance, we're working with somebody we haven't heard from them for a while, we can be at the community and look for them, go door knocking, things like that. But basically just keep them, keep them connected to the program and act as a peer mentor.
sounds good. What about Alderson?
Thank you, Mrs. Chair. I know this event cover my question, but it's really important. So when people get released from facility, it's a challenge.
Absolutely.
Is any parts of the program when the people get released doesn't have a place to go? Should there be any sort of assistance with short-term temporary housing?
So sometimes people that are coming out, they have nowhere to go. They start their homelessness application on the side through 211 to go into a shelter. Otherwise, we do have some available to help pay, like if they had we can help them to get into a sober house and pay for the first month, or they can get help with basic needs from the state. But basically, sober houses and the shelter are the only resource right now for that immediate need. Some people come out, they go to halfway houses. And if they're in the halfway house first, they're there for a while, they get planned for their housing needs from there.
Thank you for taking that into consideration.
Oh,
That's
absolutely.
affecting when people get increased their needs to go.
Right, okay, absolutely. Yeah, we definitely need some stimulants.
Thank you, Mr. Chair.
Thank you. Alderman Wright?
So how many community groups do you have? Just one?
So there'll be one community advocate for good. We do have 2 life coaches that are under this grant as well, and that's through CTPIP. We also have a family case manager under this grant as well, but within, we also have other 4 part-time.
So we work collaboratively.
No, we're not. So there's, and then in addition to the community advocate, we'll be the press case manager. So we're doing our best to spread as widely as possible with what we have, and then also rely on other willing to do the food for.
And how long has this program been going on thus far? Or has it started?
Which program?
The reentry back into society.
Oh, this has been, since this grant, since inception has been 2023, and then been in full effect since the beginning of 2024.
Okay. And it's more with
Program. Yeah, we're progressing, I can say that. It's continuous program improvement.
This program's already been in operation since 2023.
Correct.
Right, okay, that's what I thought. I was confused by the opening.
It was Project More before,
Right.
and then once we had some program issues that we had to work through with Project More, and then once they were no longer a part of the grant, or a part of the funding opportunity, I should say, we needed to pivot, and that's when we put out the RFP for the grant for the Welcome Center, depending on the criteria, qualifications, and stuff.
So is this the start of the partnership?
No.
Yes.
Like for the Reentry Welcome Center,
Yes,
yes,
yes.
but the partnership, no.
Yeah. Okay. Any other questions? If you would like to ask questions, you can come testify and ask questions, or these, if you're from the press, you can ask folks that. Any other questions? Thank you for joining us.
Thank you. Yes.
Chairs don't slide so easy in the.
I just wanted to stay. Sit.
All right, having heard our presentations, we'll now hear from the public. Anybody from the public wishing to testify on either item 1 or 2, please come forward. And a third time, if there's any. Seeing none, can I hear a motion to close the public portion of the hearing?
So moved to close the public portion.
Second, all in favor of closing the public portion of the hearing, please say aye.
Aye.
Any opposed? Public portion of the meeting is closed. Do I hear a motion to move item 1?
So moved, Mr. Chair.
Hearing moved and seconded. Any discussion? I'll just say that we are excited about the expansion of services at the Financial Empowerment Center, and certainly helping our community. Legacy planning is an important service. We're glad that he's pursuing this grant. Residents. All in favor, if there's no other discussion, all in favor of item 1, please say aye.
Aye.
Any opposed? Any abstentions? Item passes. Do I hear a motion to move item 2?
So moved, Mr. Chair.
Second. Any discussion on item 2? Alderson.
Thank you, Mr. Chair. As we heard the testimony, this program is a program that made for the city and for this population that comes out. We saw in the past this population get where we have really cool in places and create some. So I am in full support of this program and report as we participate in this program.
Thank you, Alderson. Any other discussion? Also say I'm in full support. I think it's good to see the city pursuing these partnerships and continuing to evolve the programming and services provided, as Alderson said. It's back into the Haven where we're able to be there and make sure that their integration is smooth and they continue to become productive members of our community. And so that work is very important and in full support of this agreement. Any other discussion? All in favor of item 2, say aye.
Aye.
Any opposed? Any abstentions? The item passes. Do I hear a motion to adjourn?
So move, Mr. Chairman.
Second.
Hearing moved and second. All in favor of adjournment, please say aye.
Aye.
Any opposed? We are adjourned.